Welcome and thank you for standing by. At this time, all participants are in a listen-only mode. At the end of today's presentation, we will conduct a question-and-answer session. To ask a question, please press star 1. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the meeting over to Alyssa Gallagher. You may begin.
Good afternoon. My name is Alyssa Gallagher, and I'm from the Office of Communications and Public Liaison at the National Institute of Neurological Disorders and Stroke. On behalf of the NIH, I would like to welcome you to this afternoon's teleconference and to thank you for your interest in participating in this discussion with us today. Dr. Vicki Whittemore, Program Director at NINDS, who helps coordinate NIH's efforts in ME/CFS, will introduce the speakers, each of whom will make some remarks, after which we'll open the phone call for your questions. We'll try to make our remarks brief so that we can answer as many questions as possible in the time that we have available to us this afternoon. We also request that everyone ask only one question so that we can hear from as many of you as possible. Now I'll turn it over to Dr. Whittemore.
Thank you, and good afternoon, everyone, and welcome to the third telebriefing of 2018. I'm Vicki Whittemore, and I help lead the Trans-NIH ME/CFS Working Group. Dr. Koroshev, who chairs the working group, had hoped to be here today, but he has a scheduling conflict and was unable to attend, but he sends his regards to everyone. So since our last call, there have been a lot of developments at NIH related to ME/CFS, and we're excited to update you on what we've been doing. In a few moments, I'll provide updates on the new NINDS Council Working Group for ME/CFS Research. I'll also describe the latest activity in the collaborative research centers, including the PI meeting that took place last week at Jackson Laboratories in Connecticut. And Dr. Joe Green is here and will provide updates on the upcoming research meeting in April that we're very excited to be hosting here on the NIH campus. Dr. Nass, who's intramural here at NIH, at NINDS, will also update us on the intramural studies. We're delighted to be joined also by Dr. Maureen Hansen, who's the PI of the CRC at Cornell University in Ithaca, New York. She is the Liberty Hyde Bailey Professor in the Department of Molecular Biology and Genetics and the Director for the Center for Innervating Neuroimmune Disease at Cornell. In the Cornell Collaborative Research Center, Dr. Hansen and her colleagues will investigate the biological mechanisms underlying ME/CFS by obtaining blood samples and conducting brain scans on individuals with ME/CFS before and after they undergo an exercise test designed to bring on symptoms of post-exertional malaise. Dr. Hansen's team will use a wide range of tools and technologies to test the role of genes, inflammation, and the immune system in the disease. We also want to remind everyone that while ME/CFS is a trans-NIH effort, NINDS is the lead institute for this disease. The Trans Institute Working Group is composed of 24 representatives from different institutes and centers and offices across NIH, and we still continue to work very closely together to support and stimulate and accelerate research on ME/CFS. As always, we're eager to hear from you, so we'll keep our own remarks very brief before opening the phone lines for your questions. I would first like to give you an update on the NINDS Council Working Group for ME/CFS Research, and this is a group that was recently put in place. We've had 2 teleconferences now, and the group is chaired by Steve Roberts, Dr. Steve Roberts, who is the Chief Scientific Officer at the Tuberous Sclerosis Alliance. And we chose and asked Steve if he would be willing to chair this group because of his both expertise in research. He is a neuroscientist and pharmacologist, has worked in both academia, pharmaceutical companies, and now at a nonprofit. So because of his background, as well as the fact that he is a member of our NINDS Council, and we are required to have a council member on the working group. So the rest of the working group is then made up of ex officios from CDC and NIAID, Dr. Breen and Dr. Unger, as well as then other advocates, individuals with ME/CFS, clinicians, and researchers. So the second meeting we just held yesterday, Tuesday, was essentially a meeting to get organized, to really talk about what our work package will be in the end and how we will go about gathering information to help develop the recommendations that this working group will bring back to the NINDS Council. It mainly the discussion focused on really understanding the state of the research, what infrastructure needs there are, where are gaps and opportunities for research going forward, and how can NIH, and working with other federal agencies, how can we work together as federal agencies as well as together with the patient advocacy groups to really move research forward in this area and what's needed on the federal as well as in the private sector to make this happen. And so from there, I'll move on to an update about the CRCs and the Data Management Coordinating Center. So on October 15th, we had an all-day meeting that was held and hosted at Jackson Laboratories in Connecticut by Durya Unitmas. He's the PI of the center, CFS Collaborative Center there at JAX. And we had over 50 people in attendance. So not only were the principal investigators from each of the centers there, but they also had brought along graduate students, undergrads, other collaborators who are participating in the research at each of the centers. So it was a full day of exchanging information about the research that's ongoing, challenges they're having, ways in which that they can collaborate. We talked about everything from metabolomics to epigenetics to imaging studies, and it was a very fruitful day. As you know, they're just beginning their second year of funding, and many of the studies have just begun recruiting study participants. So it's early days, and there wasn't a lot of actual data presented, but I think it was a very good exchange of information about what is going on in each of the centers and ways in which they can not only collaborate, but also standardize some of the studies that are being done across the centers, such that instead of having individual groups of data from each of the centers, we'll be able to combine that data and make much more meaningful conclusions from the data in the end. So with that, I will move on and ask Dr. Breen to give an update about the research conference in April 2019. Dr. Breen?
Thank you, Vicki. My name is Joe Breen. I'm a program officer in the National Institute of Allergy and Infectious Diseases, and I work with Vicki and others on the NIH ME/CFS working group and actually manage one of the 3 CRCs on behalf of NIAID. I'd like to tell you a little bit about the upcoming research conference that we're going to be having here on the NIH campus in April. So it's April 4th and 5th in 2019. It's called Accelerating Research on ME/CFS, and there'll be 2 full days of research talks and panel discussions, and we're very excited to have Jose Montoya from Stanford and Dr. Maureen Hansen, who you'll hear from later, from Cornell as co-chairs for the meeting. And we have an organizing committee that includes researchers primarily funded by NIH, as well as stakeholders in the community from patients and patient advocacy organizations, and also NIH staff to come up with an agenda to really try and give us the fullest accounting we can of the state of research, and also try and synergize and really think about what needs we can accentuate moving forward. And the hope is, in having this meeting here on the NIH campus, we can also offer that up to the large research community here at the NIH. And of course, it'll be an open meeting, and I should add, it will also be webcast so that people who couldn't possibly travel will also be able to see the conference as well. So we're developing the agenda with the organizing committee and our co-chairs, and we actually have another call next week. And I expect in the next few weeks we'll have an agenda and start inviting people to come attend. And this meeting actually will follow directly a meeting that's organized by NINDS for young investigators that perhaps, Vicki, you'd like to talk about.
Sure. Thanks, Dr. Breen. So the conference itself that Joe talked about will take place on April 4th and 5th, and the day before, April 3rd, we are organizing a one-day workshop for young investigators that will bring undergrads, graduate students, postdocs together to work with NIH program staff across NIH on grant writing skills, and we'll be inviting researchers and clinicians from ME/CFS community to participate as well, and we'll work on career development issues, as well as then providing time in the afternoon for them to present their science to one another and get critiqued and get advice from each other to really begin to help build a pipeline of young investigators who can follow on from the excellent and contribute now and follow on from the excellent researchers we currently have involved in ME/CFS. So we've recognized for a while that this is a significant issue in ME/CFS research, and so this is an attempt to try to bring these young investigators together to really help encourage and support them, as well as to build a network that they can then begin to support each other as well and to collaborate and communicate amongst themselves as a network of young investigators in this research area. So we're looking forward to both the conference and the Young Investigator Conference workshop. Did you have anything else, Dr. Breen?
I didn't.
Okay. So from that, we'll move on to Dr. Nath, who has joined us. He's away at a conference. Thank you, Dr. Nath, for joining us for an update on the intramural study.
Yeah, thanks, Vicki. So I really don't have anything new to report. Things are coming along really well. Recruitment is continuing, and everything's progressing as planned. So I think we're on target.
Excellent. Thank you. Thank you for joining us. So we'll move on now to Dr. Maureen Hansen, who's going to give us an overview of the research that's going on at the Cornell Collaborative Research Center for ME/CFS. Dr. Hansen?
Thanks. Actually, you gave a very good summary of the goals of our center. And I would also like to mention that there's a lot more information about our center's projects that you can read about at neuroimmune.cornell.edu. Especially, I would suggest looking at the news section of that website, which has useful information about how subjects can participate in our studies, as well as it has a number of links to presentations that I have done that will allow you to learn a lot more about our center than I can possibly give in a few minutes on the phone. Recently, I gave a presentation at the Webcast Stanford Symposium in September. That is available on YouTube. Another presentation that can be obtained is a presentation that I did at the Invest in ME meeting last June that can be ordered from Invest in ME, and you can receive a DVD that has the presentations of all the speakers at the patient meeting. And finally, I gave a talk at the Solve ME/CFS Discovery Forum last October in which I outlined the 3 projects that our center will be carrying out. The first one of those projects is a neuroimaging project that will be assessing neuroinflammation in the brain before and after an exercise challenge. That's being carried out by Dr. Tacoma Shungu at Cornell Medical School. Then my project being carried out in my laboratory is a project to study the role of extracellular vesicles in ME/CFS. We have been doing some pilot studies on samples without exercise. We're going to be looking before and after, but to get our technology fine-tuned, we've done a pilot study to observe whether the cargo inside these extracellular vesicles is different in patients versus control, and we have some interesting data indicating that the cytokine content of these vesicles is different in patients versus controls. So finally, the last study that is being carried out, the third project, is being led by Dr. Andrew Grimson, who will be performing single-cell RNA sequencing on white blood cells from patients and controls. And he's also been fine-tuning the methodology for this very new method that has been quite useful to identify differences in the immune system between people who have various diseases, and I think it will be quite important to study this in ME/CFS. So that's basically an overview of what we're doing. We are actively screening and testing people at this time, and that's going to be continuing on for the rest of the year and also next year. So there's plenty of opportunity for subjects to volunteer to participate. And to do that, please have a look at at our website with the appropriate numbers that you would appropriate emails that you would contact people in New York City or in Ithaca if you want to participate at the Ithaca or Los Angeles site. So that's pretty much what I have to let you know about right now.
Great. Thank you, Dr. Hansen. So at this point, we will open up the lines to your questions, and we look forward to your questions and to seeing how we can provide more information for you.
At this time, if you would like to ask a question, please press star 1. Please unmute your phone and record your first and last name clearly when prompted, as well as your affiliation. Both pieces of information are required to introduce your question. To withdraw your question, you may press star 2. Once again, at this time, if you would like to ask a question, please press star 1. And our first question is from Denise Lopez Marjano with Advocate. Your line is open.
Good afternoon. Thanks very much for the call. There's been an awful lot said today that's very, very interesting. It raises an awful lot of questions in my mind. One of my first questions, though, is when is NIH going to issue a program announcement specific to ME/CFS? Given that investigator-initiated funding has dropped by 30% in 2018, it seems like an easy way for NIH to advertise how serious NIH is about ME/CFS grant funding. As Dr. Collins said in 2015, give us a chance. Well, the last program announcement was in 2015. Seems like it's more than time for another one. And another question I have is for Dr. Knapp, and that is, I understand that no patients for the Lyme control group have been identified yet for the intramural study, and I was wondering how that is going to be pushed. Thank you very much.
Thank you for the questions. Dr. Knapp, do you want to answer the question about the Lyme disease patients first? Dr. Knapp? Okay, so are you muted, Dr. Knapp?
Looks like he's still connected, or he may be on mute.
Okay, well, I'll go ahead and answer the first question that you had, Denise. So, yes, we're very concerned about the low number of grant applications that are coming in, and we were considering issuing a program announcement, but NIH has just announced that they will no longer issue program announcements, and instead they're putting a different process in place for special topics of interest. So we're exploring what that process will be and are interested in pursuing that. We certainly are talking to individual investigators. We put them in touch with the appropriate institute and appropriate program director to try to assist them as they submit their applications. and are encouraging individuals to submit grant applications to NIH. So we're looking at ways in which we can really try to bolster the number of applications that are coming in to NIH. Dr. Nass, are you available? We are not hearing Dr. Nass, so we'll come back to that question, Denise, if he is able to rejoin us later. Next question, please.
Our next question is from Wilhelmina Jenkins. Your line is open.
Thank you. I'm going to follow up a little bit on what Denise said about the need for urgency at the moment. It's been very disturbing in the patient community to see that 30% drop in individual grants, and we understand it's because of the low number of applications for grants that are coming in. However, ME Action submitted a long list of methods of hopefully improving the granting situation. It was a very thorough list of 11 different methods within the NIH doing things that would help. I'm wondering if you might be working on those through the working group. I know that Dr. Collins and Dr. Gorsuch are not here, but if either one of them has considered that list of possible means of improving the research community. This has been a very long and agonizing struggle for most of us. I've been ill since 1983. I was diagnosed in 1988. I haven't been able to work since 1987. I also have a daughter with this illness. And my big hope in life is to get some serious research done in my lifetime. I'll be 69 next month. This has been a long struggle. What we need to see is some more urgency, and I'm really wondering what happened with those recommendations. They were well thought out, and effort was made to make sure they were within NIH guidelines. I know it's hard to jumpstart, but considering the responsibility that NIH has for, in the past, and I understand it's a different group of people, but in the past it's been NIH's fault that this has slowed down to such a horrible crawl. Aside from the working group, are you looking at any other mechanisms to get things underway?
So I'll answer your question in several ways. So first of all, yes, the Trans NIH Working Group, which is our internal NIH working group, is looking at those recommendations. But we are also working together with the NINDS Working Group of Council, of which ME Action is a member. Jen Bria is a member of that working group. So those recommendations are being considered as part of the work of the working group and will be considered as part of their recommendations. In addition, I do know that ME Action requested a meeting with Dr. Collins, and they're attempting to finalize a date with ME Action in December for that meeting. So those recommendations will also be addressed at that meeting, and ways in which NIH can begin to address the recommendations that were made in the petition. So, yes, thank you for that question. Next question, please.
Our next question is from Eileen Holderman. Your line is open.
Yes, good morning. This is Eileen Holderman. My question is for Dr. Nath, if he is back on the line. Is Dr. Wallet still on the NIH intramural study? If not, why not, and who replaced him? And my second question is, I noticed that all the NIH committees and work groups that are formed around all these initiatives are comprised of organizations or individuals who promote SEID, the IOM definition and name. And I'm wondering, especially in light of this upcoming April conference, if NIH is going to balance the stakeholder representation and invite a group such as meadvocacy.org and independent advocates like Gabby Klein or myself, Jeanette Burmeister, to be a part of that, since we are very public about our opposition against utilizing the IOM criteria and name. Thank you.
Yeah, so this is Avi. Yep, I'll take the first part of your question. Yes, Dr. Wallet is very much part of our team. So there are no plans to replace him. He's doing a great job.
So Dr. Nath, can you, while we have you, also address the question that came up about recruitment of the Lyme patients for the intramural study? What is the status? When will they be recruited?
When will who be recruited, sorry?
The post-Lyme patients.
Oh, the post-Lyme. Yeah. So Andrea Markey, she is the expert on the Lyme study. And so she wanted a number of amendments to the protocol for that purpose. So we put those amendments in, and as soon as they get approved, then I think she's going to start recruitment and see if we are able to recruit some of those patients or not.
Okay, thank you.
All right, sure.
I'll answer the part about the involvement of advocates in the working groups. Specifically for the NIH Working Group of Council, we will be we're planning several focus groups, and we'll be soliciting information from anyone who wants to participate in those focus groups. So the working group is planning to have a meeting coming up where we will really begin to finalize what those focus groups will look like and when and how they will be held, probably by webinar, I would guess. But we will get more information out to everyone as soon as those are planned, but we certainly will be soliciting that information. So thank you for those questions. Next question, please.
Our next question is from Mark Carmenzin with Cure ME. Your line is open.
Yeah, my name's Mark Carmenzin, and my son has a very severe ME. He has such severe light sensitivity, a starry night would make him scream. And I don't think they're looking enough at light sensitivity. And then CFSAC was a good forum for getting all the agencies together, CDC, FDA, Veterans Administration, and the like. And that has gone away, which is just unconscionable. So we need to have more focus, not just at NIH, but providing more fair funding going toward $200 million, which would be fair per year based on dailies or disease burden. And anything less is gross discrimination. You are ramping. I give you credit for that, but you have to ramp much faster. I worry about my son dying daily, and this is just not fair for 1 to 2 million who are ill in the United States. So I hope you can ramp much faster and include a lot more emphasis on degree of light sensitivity, just not am I a little sensitive to light, but many are extremely sensitive to light or sound. And I think looking at biomarkers for that, do you have autoimmune to neurotransmitters, what's going on, could provide insight for the less severe cases also. Thank you.
Thank you, Mark. I will take that suggestion about the light sensitivity back to the Trans NIH Working Group. I think that's very interesting, and you're right. That's not something that, at least to my knowledge, is currently being explored, but should be. So thank you for that suggestion. With regard to CFSAC, we were not aware that CFSAC was going to be sunset. There is still communication between the federal agencies, and we're looking, and again, one of the things that the NINDS Working Group of Council will be doing is helping us to put an infrastructure in place for continuing that communication and collaboration between the agencies. So I think what CFSAC helped to do was to identify who those individuals are within each of the federal agencies. And so whenever we do need to communicate with them, we are, just not in a formal setting like CFSAC. So we look forward to, and I agree, it would be great to have greater and broader partnerships with other federal agencies. So the next question, please.
Our next question is from Leonard Jason with DePaul University. Your line is open.
Thank you. Vicki, you mentioned that PAs are going to be discontinued at NIH. I'm wondering if RFAs are also going to be discontinued, and if they are going to not be discontinued, is there any possibility of there being an RFA for this field?
So program announcements are being discontinued, but RFAs are not. And I think the distinction is that RFAs typically do have some set-aside funding associated with them, whereas program announcements are essentially just an announcement that we're interested in receiving grants in a particular area of research. In addition, there will continue to be program announcements, what are called PARs, which are program announcements that have special review. So what that means is that you can have a program announcement with a specially established review group, a special emphasis panel for review. And you can also, we will be able to have a program announcement with set aside, a PAF, which means it's a program announcement with specific funding. One of the things on the working group of council's list things to advise us on are moving forward whether we should issue any of the PAR, PAF category or RFAs. And we also are planning to do a survey and discussions with the community about the research gaps to really understand where the research needs are. It's one thing to put out a very broad research funding announcement, whereas it sometimes is much more beneficial if it can be more focused on areas of need. And so those are some of the things that we're looking into as to how to be most effective and to really stimulate the research that needs to be done next in CFS. So thank you for that question, and hopefully we'll be able to move on those kinds of things in the near future. The next question, please.
Our next question is from Annette Whitmore with Whitmore Peterson Institute. Your line is open.
Thank you. Yes, this is Annette, and my question is for Dr. Nath. I noticed that he has made some progress in HERVs, human endogenous retroviral expression, and in MS and ALS, both with MS HERV-W and ALS HERV-K. And I was wondering, is he pursuing studying the activated HERVs as a potential pathogenic mechanism in ME/CFS? And if not, would it be possible to take that up with the intramural study group?
Yeah, thanks very much for that question. So the answer is yes. As you know, endogenous retroviruses were once looked at previously in ME/CFS, and the initial reports didn't really pan out, and it turned out to be all contamination. So we have to be very careful in looking at these endogenous retroviral elements. Yes, our lab has a lot of expertise in that area, and so it makes sense that we will definitely look at it. What pans out remains to be seen.
I was speaking of endogenous retroviruses versus the exogenous, and I understand.
Endogenous, yeah.
Right.
Mm-hmm. Yeah.
Right.
I know
great. That is very encouraging. Thank you so much, Dr. Nath.
Mm-hmm. Sure. You're welcome. Mm-hmm.
And thank you. The next question, please.
Our next question is from Deborah Woroff with ME/CFS. Your line is open.
Yes, that should be ME/CFS alert. I'm sorry. I see a lot of programs where money is flowing like a river in spring, notably precision medicine and the BRAIN project, and, of course, the AIDS budget of $3 billion, which Dr. Nath is associated with, and where he does a great deal of work related to issues of encephalomyelitis or encephalitis or other forms of brain dysfunction such as are seen in ME. And I am wondering what the current trans-NIH group might think of doing to implant our work in some of these areas of research that are hugely funded. Thank you.
So thank you for the question, Deborah. So as you know, many of these programs are addressing current issues such as the opioid addiction problem. And so NIH has put in place a program to deal with not only opioid addiction, but also pain mechanisms and non-opioid treatments for pain. And those programs are actually just being formulated, and the RFAs released. I think some of them have been released or will be released soon. But I would expect and hope that some of those programs that deal specifically with pain could also involve research on pain as it is involved in individuals and treatment of pain for individuals with ME/CFS. Some of the other initiatives, such as the BRAIN Initiative, they are currently, well, let me back up. So the first part of the BRAIN Initiative was really to develop new technologies to study the brain, and they're now moving into ways to apply that technology to studies of the brain and brain disease and disorders. And so again, I would think that and hope that there would be investigators out there that could utilize some of the initiatives and RFAs that are coming out within the BRAIN Initiative to apply those new technologies and request funding or submit grant applications as they apply to studies in ME/CFS. I think that there is a need, obviously, for additional research, but I think there's a need to try to also bring individuals outside the ME/CFS field with expertise, say in brain imaging, in pain treatments, to the ME/CFS research community. So this may be ways in which to do that.
And at this time, I'm showing no further questions.
Are there any additional questions anyone has for either us or for Dr. Hansen?
And at this time, I would like to remind participants, if you would like to ask a question at this time, to please press star 1. All right, and we do have a question from Eileen Holderman. Your line is open.
Yes, hi, thanks. I just wanted to go back to the question that I had that I feel like it wasn't really adequately answered, and I wanted to give you the opportunity to fully answer my question, and that is why, when NIH makes the selections for the stakeholders, such as the committees and work groups and such, for all the different projects, why isn't there more balance of stakeholders, the stakeholders that are openly opposed to the IOM criteria and definition? And how are you going to ensure more balance going forward?
So I'm sorry I didn't answer your question before, Eileen. So in large part, especially for the working group of council, the advocates from and the organizations that were selected are those that we have been in communication with and working with actively, and those like Solve ME/CFS Initiative, who actively fund research. And so I think that we are open to lots of opinions, and I think that we are looking forward to having those opinions put forward to us through focus groups. We may do a request for information in the future, but I don't want anyone to think that we're trying to bias our work product or the way that we're moving forward by only selecting individuals from certain organizations. So I think, it's in large part the people that we have been actively engaging with and who have stepped forward to be willing to work with us on these working groups. And so I encourage you to be in touch with us and to put your voice forward. And we're certainly willing to talk with you and to hear your opinions as well.
And our next question is from Donna Dearson. Your line is open.
Hi, it's Donna Pearson. I'm wondering if Dr. Knapp might be able to share with us some of the reasons that so many of the people were screened out of the NIH study.
Dr. Knapp?
Okay, looks like he actually dropped off of the call.
So, Donna, thank you for that question. I can try to answer because I've heard him answer this question before. But so starting with the first screen, typically screens out individuals who are not within the age range that they're recruiting, don't meet other criteria, and or are found to have had ME/CFS for longer than the 3 years as part of their recruitment criteria. So that's the first screen. The second screen is typically done, my understanding, through a phone call with the individual, and very often then they identify that the individual has either other significant underlying diseases or comorbidities, other things that would disqualify them from participating. And then there's an additional screen that happens once they're then brought into they qualify, they review their medical records, and they bring them to NIH after the first visit. Then individuals are screened through an adjudication committee that then determines whether this committee truly believes that this individual has ME/CFS, fits all the inclusion criteria in order to move forward in the study. I don't think, and I may be wrong, I don't think that they have excluded anyone that's come in for the first part of the study from them continuing in the study. I may be wrong about that, but I think that they have such strict inclusion criteria that by the time you get to actually coming to NIH, the number of individuals that are invited to participate have really been reduced from the number of initial inquiries. I think that there clearly are other issues around just scheduling and getting people to come into NIH, because that can be difficult depending on the individual's health, their schedules, complicating things. I know that there, for example, was one individual that was going to come and then she became pregnant, so then could not participate in the study. So I think that there are lots of reasons around why people are, in the end, excluded from the study. So I hope that answers your question. We can have Dr. Knapp address that when he is on the next call. Next question, please.
Our next question is from Eric Johns. Your line is open.
Yes, hi. My question was also for Dr. Nath, who is not on the call now. But I was wondering what the methodology is for recruiting patients with persistent Lyme disease or chronic Lyme. It seems concerning that nobody has been recruited thus far, so I'd like to know the methodology.
So this is Dr. Breen. So Dr. Nath made a reference earlier. So Dr. Adriana Marquez is the investigator who's leading that effort, and she had some changes to the amendment for the protocol that she needed to have completed before she started recruiting, because it wouldn't make sense to change it midway. And what Dr. Nath said is that those amendments should be accepted soon, and then she can start recruiting. So there's no functional reason. It's really a paperwork issue that she had some amendments, most likely to improve the protocol based on what's happened already, before she started recruiting the post-Lyme patients.
Okay, thank you. Next question, please.
Our next question is from Leonard Jason with DePaul University. Your line is open.
Yes, thank you. This has been extremely helpful and informative, so thank you all for participating. I had a question about really how do we attract new people to the field, particularly young investigators, and I think the funding opportunities and the the types of mechanisms that are being talked about are certainly important and positive. But one question I have is it possible that there's an impediment or a hurdle for new people who might come into the field and be saying to themselves, how do I select research participants if some are suggesting that the SCID IOM clinical criteria should be used, others are suggesting that maybe the Canadian criteria, consensus criteria should be used, and some are others suggesting MEICC should be used, and still others maybe Ramsey criteria. So if there's different criteria that are being recommended, is that possible that could be an impediment to interesting people who really want to have a consensus on this issue if they're going to get interested in pursuing research in this area? Thank you.
Hi, Dr. Jason. This is Dr. Breen. I think that is part of what makes it challenging to get younger investigators engaged, is because it's a complex landscape, and the bottom line is that the biology is still very challenging. So I think we have to continue to do some of the things that we're doing and try and come up with new, creative, innovative ways to bring young people into the field, such as the Young Investigator Forum, having meetings where we can talk about the latest research results and try and bring in expertise that maybe would be applied to this disease from outside investigators, and we really try and build the case that there's tremendous biological question at play here that we want to encourage people to get involved with. But I think it's really hard. So that's part of the hurdle that we're up against. And tools like RFAs and program announcements are part of that, but also trying to let people understand where the gaps are in the field and what are the opportunities as well. What are the recent findings that really generate some interest in perhaps, for example, discovering a biomarker that might help differentiate some of the challenges that you outlined. We're certainly hoping that some of the things that we're supporting in the CRCs will lead to that. But I think that just represents where we are today, and we try and bring as many of our tools as we can to try and increase. But as we've heard, we can always do better, and we need to keep working toward that aim.
Great. Thank you for the response, Dr. Breen. Next question, please.
Our next question is from Denise Lopez Marjano with Advocate. Your line is open.
Hello again. My question is for Dr. Hansen. You mentioned the extracellular vesicle study that you're doing, and that there seems to be a difference in cytokines in people with ME and controls. I'm wondering if there's other illness groups that are being looked at as well to differentiate whether the cytokine difference is just a result of illness or specific to ME. Thank you.
In our study, we're not looking at another illness group, but there are studies being done in other diseases where people are examining cytokines in extracellular vesicles. And what's interesting about those, there's a recent paper that was quite interesting showing that the cytokines that are in the extracellular vesicles are different from the ones that are in plasma. So all the studies that you've heard about that have been done on ME/CFS and controls before, we're comparing the cytokines in plasma or serum between patients and controls, and it does turn out, and we also have data like this, that the plasma cytokine are different than the cytokines that are compartmentalized in these extracellular vesicles. So I think there's, extracellular vesicles is a fairly new area of research, and I think there's a lot to be learned about it. But I do know there's work underway to study the role of extracellular vesicles in cancer, in diabetes, in Alzheimer's disease. So there's going to be a lot of information from other diseases that we'll be able to compare to our results with ME/CFS. The other aspect about our work that allows us to make conclusions about the role of, for example, any of the features we're studying, we're able to use the patients as their own control because we are comparing them before they undergo post-exertional malaise and after. So we'll be able to see it. We'll be able to find out what happens after an exercise challenge, so that we can look at the patient in two different states, and that allows us to learn a lot more about the individual patient and how this phenomenon of post-exertional malaise is created by examining the same person in two different states. Thanks for your question.
Thank you. Next question, please.
Our next question is from John Martin. Your line is open.
Yeah, hi. I'd like to encourage NIH to look back over some of the research that I did some time ago showing atypical viruses, which are referred to as stealth-adapted viruses, being a cause or commonly present in CFS patients. And the reason for bringing this up again, we've now extended that work to show a non-immunological defense mechanism against these atypical viruses. So happy to hear back from any of the members to expand upon this work. But I know that if the effort is made to culture viruses from CFS patients, they will turn out positive. And I look forward to any feedback. Thank you.
John, this is Dr. Breen. I appreciate your input, and I'd like to know more about it, actually. We do have Dr. Ian Lipkin is doing some scanning for viruses, but there's no guarantee that he is looking in the same even family that you're talking about. So I'd like to follow up if that's possible.
Well, I'm happy to do so. Thank you.
I'd like to add that I would be glad to have you email me information about your studies. So my email address is easily found on Google by Googling my name. So I would be glad to see. I'd be glad to learn more about your studies as well.
Thank you. Next question, please.
Our next question is from Mark Carmenzen with Cure ME. Your line is open.
Yeah, this is Mark Carmenzen. We have a Senate Resolution 508 trying to raise awareness, which is great, but we need to have all the states aware, and once we do, we need to have NIH work with CDC to assess what is the incidence or the prevalence of this disease throughout every state, because right now we don't really have good statistics. So I'm wondering, can NIH coordinate with CDC so that we can get states to ask similar questions, like California has a state survey, for example, done every year, and then they could start getting much better statistics and find out if there's clusters and geographical issues like mold or whatever, who knows, or other issues. And then there's NIH does a lot of things intramurally. We need to look internationally also. The World Health Organization recognizes ME since 1969, I think it is, ICD 93.3. And so is there any coordination with the World Health Organization? The solutions could come from anywhere, Russia looking at peptides, Japan, Australia, wherever. So it needs to be coordinated internationally. And then Open Medicine Foundation just had a stellar conference September 29th. My wife and I attended at Stanford, 300 people there, 4,800 people online. And I didn't see any NIH people. Can they participate in these forums to see the best available international researchers from Norway, Sweden, that may not travel every day to NIH, or it'd be great if they did, and participate more, or do they watch this online? But anyway, it'd be nice to have them there. So do they participate in these conferences? Thanks.
Thanks for your question. I guess I wanted to address, I'll go to the last one first. The Open Medicine Foundation Forum, actually, that was available on the web, and I did register and watch part of it. I couldn't travel there. And actually, Dr. Hansen mentioned earlier that she participated, and I know that many of the people that we support participated in that forum, which sounded like a real success. So we definitely are open, and we have good communications with the Open Medicine Foundation in trying to really share information since, again, this is, there are a limited number of folks who are working on this disease, and we try and synergize however possible. So I think that that was a great conference by all accounts, because I've spoken to many people myself who were there. With regard to the international collaboration, we are beginning to do that with the CRC program, and we, I believe we have some Canadian collaborators that hopefully will come online soon, and we've had some discussions with other entities who might participate in our Collaborative Research Center network. I'm not aware of a WHO connection, to be honest.
I can address that. So I know that there is a lot of activity with the ME groups in the UK and the WHO, and we have been in contact with those groups, Action for ME in particular, who has worked quite well with the WHO. And so we're very aware of that work. And as Dr. Breen said, we're very open to collaboration and to really communicating the science that's happening around the world. I personally will be traveling to Australia to attend the conference there. I also, because it was our fiscal year end, was unable to go to the OMS conference, but did also watch it online. So I think that, in the future we can attempt to attend in person, but it just wasn't fiscally possible this year. And with regard to your first question about the CDC and epidemiology, I agree that I think it's really critical to get a better understanding of the actual numbers of individuals who are affected by ME/CFS. I think it's difficult, right, because of the difficult in the diagnosis. But I think that that's something we can take back to our colleagues at the CDC and discuss how we might approach this in a unified way.
Okay, so it looks like we have time for one more question. I know that some of you are still queued up waiting to ask questions of us. So we would invite you to send any of your unanswered questions to braininfo@ninds.nih.gov, or simply go to the NIH ME/CFS website and click on Contact Us to submit those questions. Now, one last question, please.
Our last question is from Donna Pearson. Your line is open.
Oh, hi. Something that Dr. Jason asked, and then the response to it made me uncomfortable. He implied that the IOM definition can be used for research, and the response almost seemed to imply that you guys agreed. But, in fact, the IOM was very clear that they were only creating a diagnostic criteria. Can you speak to that?
I think that was probably my answer. I didn't mean to imply that. I think what I was trying to say is that we would like to find objective biological biomarkers, because that would help alleviate some of the concern with trying to define the disease, and then would hopefully lead to a more accurate and faster diagnosis, frankly. That's really what I was trying to get at.
Okay, so in wrapping up this call, I just wanted to remind everybody that a recording and a transcript of the call will be posted to the NIH ME/CFS website next week. I'd also like to remind you about our listserv for updates from NIH. If you received a message about today's call from the NIH ME/CFS working group, then your email address has already been added to the listserv. If you received a notice from a friend but would like to be added to the listserv, please visit the NIH ME/CFS website at www.nih.gov/ME/CFS and click on Join Our Listserv at the bottom of the left sidebar. Thanks to all of you again today for an informative and thoughtful discussion, and we hope you have a good afternoon.
Thank you, everyone.
Thank you for participating in today's conference. All lines may disconnect at this time.